Today on The Doctors. No matter what age, race, religion, or sex we are, we all have one thing in common.
Our bodies are constantly changing.
And that's where we come in.
From cellulite to hair loss,
maturing, and menopause.
Right now, do not consider freezing your ovaries, but egg freezing, yes.
Make the best out of your constantly changing body. Today on The Doctors, we're changing every body, one body at a time.
Welcome to The Doctors. No matter what your age or what kind of shape you're in, we all have one thing in common. Our bodies are constantly changing. So today we're tackling some of your biggest and most embarrassing body changes.
How can I have cellulite? I'm only 36 years old and I work out every day.
What's going on with my body? When am I going to sound like a man?
I had braces for 4 years in high school. Now I'm in my early 20s and look at these teeth. They're crooked.
I'm 5 months pregnant, but I am nervous to see my body after the baby's born.
So if you've ever wondered, why is my body changing? This is the show for you. From cellulite to hair loss, even changes down there. We've got you covered whether you're going through a change now or, as we often do, we dread changes to come.
Yeah, and especially women, we dread getting older because we dread our ovaries getting older because that means that we're not going to be able to have babies anymore, or it's going to be much more difficult for us to get pregnant. And the reason why a lot of women dread that is because we're working, and so we're putting off childbearing, and you know, and also it's just hard to find Mr. Right, isn't it? He's like, well, so, you know, if you meet Mr. Right later on because you've been working or putting off childbearing, then it can, you know, you're worried about, will I still be able to have babies when I finally meet that guy? And what a lot of women have been learning about is the egg freezing. Egg freezing is actually a viable plausibility. But lately what they've said is, at least this Dr. Silber has put out, that you should freeze your ovaries. And what he did was he took little parts of women's ovaries and basically you can freeze those and then reimplant them into women. He's saying that women should start this now, but I'm telling you right here and now not to do that. The problem is that there's not been a lot of studies done with it. He only tested 12 women, or he only had success with 12 women over 14 years.
Is there a chance at some point that this procedure will become more
commonplace? Down the pipe, yes, but right now, do not consider freezing your ovaries, but egg freezing, yes, is a viable thing. And actually, I talked to my young ladies about freezing their eggs.
That women's eggs are best in their 20s, correct?
Yes, most.
So, I mean, should more women be freezing their eggs then?
That's the optimal time, between your 20s and your 30s.
And how long can you freeze your eggs for?
Right now, indeterminately.
Yeah.
And then the thawing is so much better now that it is a real viable procedure, a real viable option for women.
What if they eventually do get pregnant, have a child? Hooray, hooray, hooray. But then suddenly parents got to worry about what's the best way to discipline them. You know, and we've been debating the whole spanking thing many times before, but now there's some studies that show that maybe parents are doing something even worse. Watch this.
What do you think is worse for a child, spanking or verbal abuse?
Verbal abuse.
Why?
Because it hurts their feelings, it makes them feel bad. Maybe with spanking, like the pain goes away right after, but verbal abuse, like that's in your mind. Those words, those harmful thoughts are going to always be there.
I think verbal abuse more so demeans their character and, you know, forces them through years of torment.
Verbal abuse really, you know, is damaging to someone's soul.
Wow, that last comment hits it on the head. It's damaging to the child's soul. Yeah, there basically some new studies just compared verbal abuse, or I like to call it verbal dispraise, you know, kind of the opposite of praising, being sarcastic, critical of the child, kind of yelling at them, calling them stupid, things like that. So they compared that to spanking and showed that the verbal dispraise was actually worse. The child had higher levels of impairment, conduct disorder, depressive symptoms, and ADHD. So, you know, you see that a lot.
You spank, it's over.
It's over.
They understand, but if you say something, I mean, that can linger potentially
but I'm
for,
still
for the rest of their life.
We're not saying go spank. We're saying...
But just comparing the two, it's really damaging. I'm not saying, you can't discipline now, but you see it in the grocery store, at the mall, the child's acting up, the parent's frustrated and just basically lose their temper and starts yelling at the child or calling them stupid or names or just really demeaning to the child, and that's what's really damaging. I call it angry parenting. You just got to take the anger out of it. Sure, three-year-olds act up. And you just got to kind of separate yourself. Don't lose your temper. Yeah, they need discipline, but I like, instead of yelling at the child, telling them what they need to stop doing, just tell them what to do.
And we actually have someone joining us on the phone to weigh in on this topic. Child and family psychotherapist, Dr. Fran Wallfisch, author of The Self-Aware Parent. And Dr. Wallfisch, I think Dr. Shears just hit this on the head when he said you have to step away from maybe some of those initial feelings, because I have to believe that shouting, verbal abuse is just as bad as spanking.
That's exactly right. You can't measure one from the other. They are equally damaging.
So Dr. Wallfisch, I'm curious, what's your best advice for parents to how to deal with a child that's acting up?
What parents need to do is take a moment when their child misbehaves or something happens that upsets them before you react. That's crucial. And number two, parents need to know ahead of time what clear boundaries are, what's okay and what's not okay, and they have to make a solemn promise to themselves they will act and talk with their child without anger or rage. And finally, acknowledge and validate their child's anger. It allows the child to feel seen and heard, and then encourage your child to be able to say directly, I'm mad at you, Mommy. I don't want to turn off the TV and take a bath. If you find yourself losing it, always go back to step number one. Think before you speak, because those words are just as damaging as a physical swat.
Well, Dr. Wallfisch, thank you so much for your insights today.
Thank you. It was a pleasure.
Likewise, and the take-home for any parent out there is harsh parenting does lead to child impairment and depression.
Yeah.
Just say no again. There's a difference between discipline and harsh, angry parenting.
A couple deep breaths before you react.
I used to do timeouts with Daniel, and it got to the point where I could just look at him and he knew not to do that.
You still do that with us three. All right, boys, timeout.
You get the finger up. Oh, okay. We'll back off.
So speaking of spanking, which is what we were just discussing, let's talk a little bit about the power of touch and the effect of the mind. We all know in medicine distraction techniques can help. If you're about to do an injection for a painful tooth, if you wiggle that skin, that distraction will help mix up some of those nerve signals. And your mind works in such mysterious ways. And just to give you an idea of how much the mind does play a role in your perception of pain and also just touch. So this is called the thermal grill illusion. I'm going to stick 3 fingers in these cups.
Is it going to make you pee?
I don't know. Make a pyramid, maybe.
Yeah. So this is cold, and these 2 cups are warm. And through this illusion, believe it or not, your middle finger here is supposed to feel exceedingly hot.
Even though it's in the cold water.
Even though it's in the cold water. It's starting to feel very hot.
Weird.
Yeah, at first it felt cold. Now it's hot.
Basically,
it feels really hot.
The nerves
this is
are
crazy.
sending confusing signals to your brain.
That is so bizarre. So my middle finger is stuck in ice cold water and it feels on fire right now.
Wow.
And that's that whole idea of paradoxical thermal grill illusion. And all I have to do to show you how the mind can help teach you what's really going on is now it's cold. Because by touching it with another part of my body, this helps send signals to my brain, tells me that this middle finger is cold, these 2 are warm. Yep. And if you guys want to try this, you can do this at home. This is really interesting. Now that my hand's out, my middle finger's throbbing from the cold a little bit. It's
weird.
So interesting.
I want to try that.
This is fun. Go ahead.
It's like science class, as we go to break. Experiment here.
Coming up, we're tackling the biggest body changes everyone experiences and giving you our inside secrets on everything from fighting cellulite to keeping the sparks flying in your bedroom. Don't go anywhere.
Coming up.
Is vaginal dryness just an inevitable body change? Lately, it's like a desert down there.
Vaginal dryness just sounds like, oh, it's a little skin dry. Oh, no. There's some things you can do over the counter.
And later.
I work out every day. I eat right, but I've developed this cellulite on the back of my thighs. Why is my body changing?
The following program contains mature subject matter. Viewer discretion is advised.
Why is my body changing? It's a question every single one of us has asked ourselves at one time or another. So today we're answering your biggest questions, and nothing is off limits.
In my younger years, I felt like a woman in bloom, ripe for the picking, if you know what I mean, ladies. But lately, it's like a desert down there, like Sahara. What's going on? Is vaginal dryness just an inevitable body change? What can I do?
Dr. Lisa, this is all you.
Absolutely. Now, women who are young and who are less young, everybody needs to listen up who's a woman, because basically this is something that all women are going to deal with during their lifetime, vaginal dryness. And usually this happens because of lower levels of estrogen, but other things can cause this, like childbirth, medications, antidepressants, antihistamines. A lot of things can cause it. Surgery can cause vaginal dryness. And vaginal dryness just sounds like, oh, it's a little skin dry. Oh, no. This can be very, very irritating. It's the estrogen that drives the self-cleaning oven. And it's what keeps the walls of the vagina thick and elastic, lubricated. And so it's really important to have this estrogen. So if the estrogen's not around or these other things are causing vaginal dryness, you really need to treat it. So what you want to do, there's some things you can do over the counter. There is vitamin E capsules. which that is a secret you're going to learn today. Vitamin E capsules, because if you use the vitamin E that's in a bottle, it's not sterile. This is going to contribute to vaginal infections like douching and things like that.
Do you actually apply the capsules?
You break it open, and then you apply the liquid from the capsule.
You stick it with a pin, and then you can just squirt it out.
You can just squirt it out in there. And so this is helpful for all women. If it's estrogen is the problem,